This is a 70 years old male, known case of diabetes, hypertension, and ischemic stroke 10 years back. Now presented with the CAD SCS NSTEMI top T was 30,000 with normal LV function. And this is a iliacaudal view, and you can see there is a in LED right from proximal there is a lesion, significant lesion, a chronic lesion, which is, and I can see the distal LCX also there is a significant lesion, and the ostial LCX also there is a significant lesion. And in this right caudal view, ariocaudal view, we can see the clearly the LED proximal to mid lesion, bad lesion is almost 95% stenosis. And this is the epicranial view, and you can see the same thing right from proximal to mid LED there is a tight lesion, is almost 95%. And this is the ariocranial view, and you can see the same thing here. And this is the RCA, and you can see the ostial RCA there is a tight stenosis, is the 70 to 80% stenosis is there. So we decided to do the angioplasty to LAD and RCA because we had only 2 stent clearance in this insurance. And this is the wire shot we have taken with right radial route. We went ahead with the XB catheter 3.5 into 6, and this is the guide shot, and wanted to know the length of the stent. So this is the we wanted to do the pre-dilatation, and this is the pre-dilatation because the lesion was very tight. We have to prepare the bed for the stent. So after pre-dilatation, this is the cine, and you can see there is a, it has opened, and this is a stent 3.5 into 32 stent we placed. This is the placement of the stent, and this is the ariocranial view. And then we inflated the stent at 14 atmospheric pressure, nominal was 8. This is a 3.5 into 32 stent, and this is a picture after the stent deployment. And then we did the NC also, and then we came to the RCA. This is, you can see the right ostial lesion, tight lesion. So we decided to keep a one wire in the aorta. This is a floating wire techniques or sepal wire technique for the ostial RCA angioplasty. So this was a very tight lesion, so we decided to do the pre-dilatation with this. So this is a cranial view, and then we wanted to do the pre-dilatation. So this was a pre-dilatation, and then you can see the picture. And then we place the stent as almost 3.5 into 15 stent. Wanted to keep 2-3 studs in the aorta to flare it off later. So this is the stent placement, and then we deployed the stent at almost 14 atmospheric pressure, nominal was 8, and we flared it off with the same balloon because as a standard we should have a different balloon, that is a special balloon for the ostial lesion, which has a more diameter outside the RCA and same diameter inside the RCA, but we didn't have that, so we flared up with this balloon. And after flaring of this balloon for this ostial lesion, and this is the after stent shot, and you can see the RCA. So this was the angioplasty to LAD and RCA in this NSTEMI patient.